Hello everyone, Dr.Jyotsna here. I have a question. If a patient comes with wake-up stroke or the time of stroke onset is unknown, how you will manage the patient? How you will decide whether the patient requires IV thrombolysis or thrombectomy or not? So the answer is you have to do MRI brain. In MRI brain, if there is a diffusion-perfusion mismatch or there is a diffusion-flare mismatch, means you have to go for reperfusion therapy. So if there is a diffusion-perfusion mismatch, means diffusion restriction is there, it means that area is infarcted area. So in that area is not salvageable. But if you see in perfusion there is a flow restriction, means there is still a salvageable area. Means if the flow restricted, means the diffusion area and perfusion area, you are saying if the perfusion area is greater than the diffusion area, means still there is a salvageable tissue, there is a flow restriction is there, so you can save that area by going for thrombolysis or large vessel occlusion thrombectomy. So for that, so this is the thing. So if another thing, if there is a how you see for what is diffusion flare mismatch. Diffusion, as already I have told you, diffusion restriction means there is an infarction, and if that there is a mismatch between the flare and diffusion weighted image, means if in the flare you don't see any lesion and in diffusion weighted image you see lesion, means there is a acute infarct which is of less than 4.5 hour, means then you have to go for IV thrombolysis if no contraindication. So flare comes positive after 4 to 6 hours of onset of stroke. So if the stroke is if the flare is positive, means the patient is out of window period. And now come to the scenario where we don't have MRI facilities and we have to go for CT. We have a choice of CT scan. In that case, we have to see here also, you see for perfusion mismatch. You do a normal CT. In that you can't see any acute stroke, means you have ruled out, basically you have ruled out bleed, and in that aspect a score is greater than equal to 6. And now you go for CT perfusion. In that there is a difference in the core area and the perfusion restriction in the penumbra. So there is a salvageable ischemic area. So again you can go for thrombolysis plus thrombectomy. Thank you.